Okay, I'm Lucia Masarova from MD Anderson Cancer Center in Houston, Texas. And this ASH in San Diego, we are presenting a study comparing momelotinib and ruxolitinib from Simplify-1 for medical cost saving with outpatient transfusions and time burden saving with our patients. The reason we looked into this was because transfusion burden is a very relevant factor for our patients with myelofibrosis. And momelotinib, which is the newest approved JAK inhibitor that also inhibits ACVR1 and then via hepcidin improves anemia, has shown improved transfusion dependency and achievement of transfusion independency in Simplify-1. Simplify-1 was a randomized phase 3 head-to-head comparing momelotinib and ruxolitinib, which is JAK1, JAK2 inhibitor that has been already approved for patients with higher risk of myelofibrosis in in vitro therapy. And this study, what we also compared here, was that we showed that momelotinib did indeed had a higher transfusion independence, and also patient achieved transfusion dependence, less transfusion dependence if they started with transfusion. And then we looked at the saving of medical costs as well as outpatient medical costs associated with transfusion, comparing the data of achievement transfusion independence at 24 weeks on the study with currently available data with databases. One was using a marketplace database and the other one for patients over the age of 65, Medicare fee-for-services. So by comparison, we actually shown that indeed decreasing transfusion dependency led to saving in terms of an overall medical cost that was seen across all patients enrolled, which was quite a large study, included 215 patients for ruxolitinib and 217 for momelotinib in head-to-head comparisons. It also showed the same data in a medical cost saving for baseline anemia-dependent patients as well as patients over the age of 65. In that area, the medical cost savings ranged from at least $20,000 per year to up to almost $50,000 a year for transfusion-dependent patients with anemia at the baseline and independence. And then we also looked at how much this could translate into saving outpatient transfusions, as well as the time burden that our patients have to face when they come in for transfusions. That is actually accounting for preparation, ordering, waiting time, delivery of transfusions, being safe and going home. So all of those hours were accounted for, and compared to available data, the ones was a little bit more indirect from data for thalassemia beta-dependent patients, because there's not so much to compare these data in the databases. So overall, with the outpatient transfusion cost saved, that was very similar what I just said about the overall medical cost saving, about $20,000 or more for patients with either baseline anemia transfusion independency, and then patients over the age of 65. And then for a time burden saving, there was something I was excited about as well that showed at least 108 hours or higher saving per year associated with coming in the clinics and getting the transfusions. So overall, in this study, we showed that momelotinib does lead to decreased transfusion dependency and usage transfusion in our patients, which also translated in the medical cost, healthcare cost saving, and more importantly to me, time burden saving for our patients.